The dexamethasone suppression test checks to see how taking this kind of medicine called dexamethasone changes the cortisol levels in our blood. So dexamethasone is like cortisol. It lowers the amount of the adrenocorticotropic hormone released by the pituitary gland. Normally, if a dose of dexamethasone is administered to our body, the cortisol levels will become low. But if the cortisol levels remain very high, it is a manifestation that that patient is having Cushing's syndrome. So the night before the blood test, you will take a dexamethasone pill. The next morning, the cortisol levels will be measured, and if it stays very high, the cause might be the Cushing syndrome. The insulin tolerance test is a diagnostic test in which the individual receives insulin through IV infusion to determine whether the pituitary or the adrenal glands are functioning properly. When administered with insulin, the patient becomes very hypoglycemic. And under normal conditions, our body will try to counteract and compensate. So it raises our blood sugar levels. Specifically, the pituitary gland and the growth hormone will do the job. But if the patient has adrenal insufficiency, he will remain hypoglycemic. Methylropone test is a diagnostic test used to determine if the patient is having adrenocorticotropic hormone deficiency. When methylropone is administered in the body, it inhibits the conversion of 11-deoxycortisol to cortisol, which induces the decrease in cortisol levels and increase in serum 11-deoxycortisol. The resulting increase of 11-deoxycortisol in healthy individuals would trigger the release of ACTH. If ACTH remains low, it might be a sign of ACTH deficiency.
Amylase test. This measures the amount of this enzyme in a sample of blood taken from a vein or in a sample of urine. Normally, only low levels of amylase are found in the blood or urine. But if the pancreas or salivary glands become damaged or blocked, more amylase is usually released in the blood and urine. This test is used as a common screening and monitoring parameter for acute pancreatitis. This is also used for checking the swelling and the inflammation of the salivary gland. C-peptide test. A C-peptide test measures the level of these peptides in the blood. It is generally found in the amounts equal to insulin, because insulin and C-peptide are linked when first made by the pancreas. Insulin helps the body use and control the amounts of sugar in the blood. Insulin allows glucose to enter to body cells where it is used for energy. The levels of C-peptide in the blood can show how much insulin is made by the pancreas. The purpose of C-peptide tests is to tell the difference between type 1 diabetes and type 2 diabetes, to find the cause of low blood sugar or hypoglycemia, to check and see whether the tumor of the pancreas or insulinoma was completely removed. To perform this C-peptide test, the usual blood test is done. If fasting for 8 hours is highly required. Glucose tolerance test. The glucose tolerance test is a medical test in which the glucose is given and blood samples are taken afterward to determine how quickly it is cleared from the blood. The test is usually used to test for diabetes, insulin resistance, impaired beta cells function, and sometimes reactive hypoglycemia and acromegaly. At these tests, the person being tested starts the test in a fasting state, having no food or drink except water for at least 10 hours but not greater than 16 hours. An initial blood sugar is drawn and then the person is given a glucola, a bottle with a high amount of sugar in it. It may be 75 grams of glucose or 100 grams for pregnant women. The person then has their blood tested. Normally, the serum blood glucose level is less than 200 milligrams per deciliter at 30 minutes, 60 minutes, and 90 minutes, and less than 140 milligrams per deciliter at 2 hours.
Glucose tolerance test. a test of the body's ability to metabolize glucose that involves the administration of a measured dose of glucose to the fasting stomach and the determination of glucose levels in the blood and urine at measured intervals thereafter, and that is used specially to detect diabetes mellitus. During the test, a technician will take a blood sample to measure your baseline glucose level. This part of the test is also called the fasting glucose test. Random serum glucose. Glucose testing is a random blood test to check glucose levels. It is usually done by pricking the finger to draw a small drop of blood. This blood is then wiped onto a test strip that will give a glucose reading. This is a powerful tool for the people with diabetes. Glycosylated hemoglobin is a test commonly used to see if a patient is suffering from type 1 and type 2 diabetes. During the test, a needle is inserted on the vein in your arm by a member of healthcare team in order to take a sample of your blood during the glycosylated hemoglobin test. Insulin tolerance test is a medical diagnostic procedure during which insulin is injected into a patient's vein. This procedure is performed to assess pituitary function, adrenal function, and sometimes for other purposes. A health professional will usually draw the blood from a vein. A lipase test measures the amount of this enzyme in a blood sample. A lipase test is done to check your pancreatitis, another disease of the pancreas. The health professional taking a sample of your blood will wrap an elastic band around your upper arm to stop the flow of the blood.
Pituitary gland is a tiny organ the size of a pea found at the base of the brain. It produces many hormones that travels throughout the body. It composes anterior and posterior pituitary gland. Anterior pituitary gland includes growth hormone, prolactin, thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, and adrenocorticotropic hormone. Pituitary function is assessed by measuring the concentration of hormones at the baseline and after stimulation or suppression. Is growth hormone, also known as human growth hormone, HGH, or somatropin. The purpose of serum growth hormone test used to measure the amount of GH in your blood. It is not just a routine blood test since abnormalities of GH are uncommon. You can use physical tests. Your doctor will check your weight, height, and body proportions. You can also use blood tests. First, for binding protein levels IGF-1 and IGF-BP3 to show whether the growth problem is caused by pituitary gland. Second is to measure the amount of GH levels in blood. Third, to measure other levels in hormones produced by pituitary gland. Fourth, and lastly, to measure insulin tolerance. Why? Because it counteracts the effect of insulin in glucose. Additional exams and tests to help diagnose growth hormone deficiency is MRI or magnetic resonance imaging and X-rays to show any problems with bone growth and growth of your skull. There are 5 steps. Read and understand. The purpose of this test is to induce contractions and monitor the fetus to check for heart rate and abnormalities, and also to make sure that the baby can get oxygen he needs from the placenta during labor. We can use cardiotocograph. It is a type of antenatal or before labor fetal surveillance technique. A wire electrode is attached to the fetal scalp through the cervical opening and is connected to the monitor. It is performed weekly. The expected contractions in a 10-minute period is 3 contractions. Adrenocorticotropic hormone stimulates the production and release of cortisol by the cortex of adrenal gland. Do the blood test and measure the cortisol level. Cosintropin is injected. Draw blood again to re-evaluate cortisol level. The doctor will check your level twice, 30 and 60 minutes after the injection. Free thyroxine index. The major function is to bound transport proteins. The TBG or thyroxine binding globulin. The purpose of this test is to determine and provide correct information whether the TBG is normal or not.
Thyroid stimulating hormone. This test measures how much of this hormone is in your blood. This is produced by the pituitary gland in your brain. This gland tells your thyroid to make and release the thyroid hormones into your blood. This test is done to find out if your thyroid gland is working the way it should. It can tell you if it's overactive or hyperthyroidism or underactive or hypothyroidism. This test can also detect a thyroid disorder, radioactive iodine uptake. It tests the thyroid function and finds the cause of hyperthyroidism. The thyroid takes up iodine from the blood to make thyroid hormones, which is why called an uptake test. First, you are given a pill that contains a tiny amount of radioactive iodine. After swallowing it, you wait as the iodine collects in the thyroid. Second, first scan is usually done 4 to 6 hours after you take the iodine pill. Another scan is usually done 24 hours later. During the scan, you lie on your back on a table. Thyrotropin releasing hormone. Most doctors use the TSH test or the thyroid stimulating hormone test, which measures the circulating level of TSH in the bloodstream at one point in time. The TSH test results are then interpreted. If your levels are higher or lower than the reference range, this is considered evidence of potential thyroid disease. The TRH test is different. First, a baseline TSH is done. Then you're given a dose of TRH through your vein, which stimulates your pituitary to release TSH. A second blood sample is then drawn 20 to 60 minutes later, and TSH level is retested. Some practitioners feel that the TRH test can detect subtle thyroid problems and measure your thyroid's ability to respond in real time, compared to the TSH test, which is a snapshot of thyroid function in one point at a time. Triiodothyronine uptake. The thyroid produces a hormone called triiodothyronine known as T3. It also produces a hormone called thyroxine known as T4. Together, these hormones regulate your body's temperature, metabolism, and heart rate. The T3 test simply involves having your blood drawn. The blood will then be tested in a laboratory. Typically, normal results range from 100 to 200 nanograms per deciliter.